Hello, I'm Dr. Dave Roberts, Chief Medical Officer at West Tennessee Healthcare and Jackson General. The healthcare team at Jackson General wants to help you prepare for your discharge home. We want to prepare you from the beginning of your hospitalization until your discharge. We want to make sure that you have all the help you need to take good care of you and your baby when you arrive home. We will provide you with a blue folder which contains helpful information to help you take care of you and your baby once you arrive home. We want to thank you for allowing us to be involved in your care and wish you and your family the best.
Your baby should have only breast milk for the first 4 to 6 months of life. After that, advance infant's diet at the recommendation of your pediatrician. You may need to awaken your baby for feedings during the first few weeks at home. Some spitting up is common with feedings. However, if your infant has forceful or dark green or blood in their spit up, call your pediatrician. For more information, contact lactation consultant. Changing the diaper before each feeding helps wake the baby so it will eat and provides comfort during feeding times. Clean the diaper area with a baby wipe or warm, damp washcloth with each diaper change. Always wash from front to back to prevent germs from entering the bladder. Your baby should have 6 to 8 wet diapers each day. Call your pediatrician if your infant has no wet diapers in 24 hours. Bowel movements will vary. If your baby has gone 3 days without a bowel movement, please contact your pediatrician. Bowel movements should not be watery or loose. Contact your pediatrician if this happens. You may notice that newborn girls may have a small amount of whitish discharge or blood-tinged mucus from the vagina in the first few weeks of life. This is normal occurrence related to the mother's hormones. Bathing should be done 2 to 3 times a week. Wash your baby's face, neck, hands, and bottom daily. It is extremely important to check the temperature of the water to assure that it is lukewarm and not hot to avoid burns to your baby. Never leave your baby alone in the bath. Do not use lotions or oils as your baby's skin is sensitive and might have a reaction. Do not use powders because your baby may inhale the dust. If your baby's bottom becomes red or irritated, you may apply a small amount of diaper rash ointment and keep the area clean and dry. If it does not clear up, notify your baby's pediatrician. Dress the baby in the same fashion you are comfortable. Keep the room temperature comfortable, not too hot or not too cold. Avoid placing your infant in a draft such as in front of a window or a fan. Newborns' nails are usually soft and flexible, but can sometimes cause injury to themselves. Because newborns do not yet have control of their movements, they might claw at their face or scratch their eyes. To avoid injury, use an emery file to smooth and trim ragged nails that extend beyond the tip of the finger. For the first few weeks at home, you may need to provide care for your infant's umbilical cord stump. If so, just allow the cord to air dry. Keep the diaper folded down and away from the cord. Clean the cord with water and dry with a dry cloth to remove excess moisture. A moist, mucky appearance to the cord is normal. The umbilical cord color will change from yellowish green to a brown and then to a black color as it dries out and eventually falls off. It may take about 2 weeks for the cord to fall off, but do not pull on the umbilical cord. Allow it to fall off naturally. There may be a small amount of bleeding after the cord falls off. This is a natural occurrence and should stop. Call your baby's pediatrician if you notice redness, swelling, or drainage around the baby's belly button. Please check with the healthcare provider that is caring for your baby and follow directions that are given to you on tub bathing before the umbilical cord falls off. Your baby's temperature can very easily and accurately be taken under the arm. Place the tip of the thermometer in the armpit and hold securely in place. Normal temperature under the arm is 97.6 to 99 degrees Fahrenheit or 36.4 to 37.2 degrees Celsius. If your baby's temperature is low, reposition the thermometer and check again. Check to see if your baby is undressed or near a draft and your baby's hands or feet are cool to the touch. If so, remove from draft, apply clothing and a warm blanket, and recheck the temperature in 30 minutes. If the temperature is still low, notify your baby's pediatrician. If your baby's temperature is too high, check to see if your baby is overdressed. Ask yourself, is the room too hot? Or is your baby too close to a heat source? Recheck temperature in 30 minutes after your baby is dressed appropriately and away from the heat source. If the temperature continues to be high, notify your baby's pediatrician. The signs and symptoms of dehydration to look for are: your baby will feel cold to the touch. The inside of the mouth and the nose will be dry. You won't see tears when your baby cries. Your baby will be irritable or hard to wake up. If your baby has no wet diaper in 24 hours, call your pediatrician if you notice any of these symptoms. The American Academy of Pediatrics recommends that babies be placed on their backs to sleep. The sleep area should be empty, only a firm mattress with a fitted sheet. Do not use pillows, blankets, or toys in your baby's sleep area. These objects pose a risk for SIDS. Never allow your baby to sleep with you. This is called co-bedding. Co-bedding increases the risk of SIDS. Protect your baby from tobacco smoke. It also increases the risk of SIDS. Protect your baby from tobacco smoke. No smoking in the home or around your baby. Smoking affects your baby's respiratory system and increases the risk for SIDS. People who smoke that might care for your baby should wash their hands frequently and possibly place a blanket barrier between them and your baby to limit the transfer of tobacco chemicals. Wash your hands frequently to reduce the risk of illness or infection. While your child is an infant, you may need to suction your baby's nose or mouth frequently. To use the bulb syringe for nose, depress the bulb, then place at the opening of the nose and release gently. Express mucus on a tissue and repeat as needed. To use the bulb syringe for the mouth, depress the bulb, place it in the mouth toward the cheek area, then release gently. Suction gently. Express mucus on a tissue and repeat as needed. Clean the bulb with warm, soapy water after each use. Rinse until the warm water runs clear from the bulb, and squeeze out all excess water and suspend the bulb with the tip down in a glass to dry. Infants should always be placed in an approved car seat, rear facing, in the back seat when riding in an automobile. Please refer to your owner's manuals for safety ratings, installation, and weight limits. The infant should remain in the rear-facing car seat until he or she is at least 1 year old and weighs 20 pounds. Never place your car seat in front of an airbag. Remember, car seats do expire. Check the expiration date prior to using. The following are concerns to share with your pediatrician, so please call if your baby vomits more than twice in an 8-hour period, your infant has loose or watery stools called diarrhea, if your infant's temperature is too low or too high, if your infant's skin appears yellow or blue in color, if your infant is not having any wet diapers, if your infant begins eating poorly, if you notice white patches on the tongue or the cheek of your infant that does not go away with gentle wiping, or if your infant is breathing fast or having difficulty getting a breath, if you are unable to wake up for a feeding, or any change or difference that is not normal for your baby. Should any emergency occur, call 911 immediately. All parents are encouraged to take cardiopulmonary resuscitation CPR classes. To find out about classes given by Jackson-Madison County General Hospital, call 541-6448. We also have infant CPR instructions on your room TV on Channel 16. The English version is at 1:05 p.m. and 10:05 p.m. The Spanish version is at 1:30 p.m. and 10:30 p.m. On the day of your discharge, your pediatrician may instruct you to follow up with a weight check in 1 to 2 days and then a well baby check in 2 weeks. It is very important that you call and make these appointments with your baby's primary care provider. If you have any questions or concerns regarding the care and safety for your child, call your pediatrician. After discharge, you may discover that you still have questions about body changes, activity, and care during the next few weeks. The following information should be helpful in answering many of your questions. You can resume your daily activities at home gradually. Avoid heavy lifting, which is more than 10 pounds. Also, avoid strenuous work and sports activities. If you had a cesarean birth, you should refrain from vacuuming, stair climbing, and driving a car for 2 to 3 weeks. Nothing vaginal for 4 to 6 weeks unless otherwise directed by your physician. Inquire about resuming sexual activity at your postpartum visit. Following cesarean birth, shower as desired, but try to keep your incision dry. Do not soak in a tub of water due to the risk of infection at the incision site. Following delivery, your body is going through a drastic change in hormone levels. You may find yourself crying for no apparent reason and unable to cope with all the new changes that this new baby brings. This is normal response. Seek support from your partner and or your friends. Give yourself time to adjust. If these feelings persist after several weeks, contact your caregiver or other professionals that can help you. Seek medical care immediately if you notice bleeding that soaks a pad in an hour or less, foul-smelling discharge from your vagina, a fever of 100.4 degrees Fahrenheit, unrelieved incision or abdominal pain, swelling, redness, discharge, or bleeding from your incision site or episiotomy site. If your incision begins to separate or problems urinating, no bowel movement within 4 days of giving birth, any type of visual disturbances or severe headache, excessive swelling of your hands or your feet or your face, pain or redness in the calf of your leg, nausea with vomiting for 12 hours, pain or redness in one or both of your breasts, signs and symptoms of depression or anxiety. If you have chest pain or problems breathing, call 911. Or if you have any questions or concerns, please contact your OBGYN or your primary care physician. For more information, refer to the education materials provided in your blue folder.